Namaskar, welcome to PK's classes. Today we are going to discuss about the suicidal inhibitors. We know we can increase the enzyme activity or we can decrease the enzyme activity. That means activation or inhibition. So there are molecules that increase the enzyme activity. They are called as enzyme activators, and there are molecules which decrease the enzyme activity, and they are called as enzyme inhibitors. We know a substrate in presence of an enzyme is converted to a product. Suppose this is the enzyme with different sites. Say substrate binds to this site of the enzyme. This is the enzyme. And when the inhibitor, enzyme inhibitor also has affinity for the same site, then it will compete with the substrate. So that type of inhibition is called competitive inhibition, where the inhibitor inhibits the binding of substrate with the enzyme. So this competitive inhibition can be of two types, reversible and irreversible. So in reversible, if we increase the concentration of inhibitor, then inhibitor will bind to the enzyme. And if we increase the concentration of substrate, then the substrate will bind to the active sites of the enzyme. So we can reverse the action of substrate by increasing the concentration of inhibitor, or we can increase the action of inhibitor by we can decrease the action of inhibitor by increasing the concentration of substrate. So this is reversible. And irreversible, when there is strong binding, say covalent binding, the enzyme and inhibitor complex is strong enough, there is covalent binding, then we call it as irreversible competitive inhibition. And suicidal inhibitors, today's discussion, suicidal inhibitors are a type of irreversible competitive inhibitors. And there is another type is non-competitive. Non-competitive means the site of action of substrate and inhibitor are different. So the inhibitor inhibits the action of enzyme by binding to a different site other than the substrate. So that is non-competitive. So we will restrict our discussion today to suicidal inhibitors or suicide inhibitors. So suicidal inhibitor is an inhibitor which binds to the enzyme as a substrate initially with normal catalytic mechanism. Then after binding with the enzyme, it generates a chemically reactive intermediate that covalently bind to the enzyme to cause irreversible inhibition or inactivation, irreversible inhibition. So there is strong covalent binding and irreversible inhibition, but the thing is, initially it simply binds, and because of the binding there is generation of another product, another intermediate which is highly reactive. Then that intermediate binds to the enzyme at another site and cause irreversible inhibition, and that binding is covalent binding. And why we call it as suicide? Because the enzyme itself participates in its own irreversible inhibition. So the enzyme is responsible for this irreversible inhibition, because initially the inhibitor binds as a substrate with normal catalytic mechanism, but because of that binding there is a reactive intermediate which binds to the enzyme and cause irreversible inhibition. So the enzyme participates in its own irreversible inhibition, so we call it as suicide. So they are called as suicidal inhibitors, and such enzymes are called as suicidal enzymes. And many enzymes are there like cyclooxygenase, beta-lactamase or penicillinase, xanthine oxidase, aldehyde dehydrogenase, reverse transcriptase, ornithine decarboxylase, and many other we will discuss today. These enzymes are involved in such process where where an inhibitor can cause irreversible inhibition of these enzymes. So these enzymes are called as suicidal enzymes. So let us take some examples, discuss some examples. So suicide inhibition is suicide inactivation also you can call it, or you can call it as mechanism based inhibition, and this is an irreversible form of enzyme inhibition. So let us take one example, beta-lactamase inhibitor like clavulanic acid. So clavulanic acid is usually combined with the beta-lactam antibiotic. We know amoxicillin plus clavulanic acid. Amoxicillin is a beta-lactam antibiotic, and because of beta-lactamase there is decrease in action of amoxicillin because the beta-lactam ring is destroyed by beta-lactamase. Beta-lactamase is produced by the bacteria. So we take one beta-lactamase inhibitor like clavulanic acid, which prevents the destruction of the beta-lactam ring of amoxicillin, thereby protects the actions of the antibiotic amoxicillin. So clavulanic acid covalently binds to a serine residue in the active site of beta-lactamase, and because of this binding with the enzyme beta-lactamase, there is restructuring of clavulanic acid, making it more reactive. So it attacks another amino acid in the active site of beta-lactamase in addition to the serine. Another amino acid is occupied, and because of this there is irreversible inhibition of beta-lactamase, or there is permanent inactivation. Let us take another example. Allopurinol. Allopurinol is one anti-gout drug which acts by binding to xanthine oxidase. So allopurinol, after binding to xanthine oxidase, is converted to the active metabolite oxypurinol. This oxypurinol binds very tightly to the molybdenum sulfide complex at the active site of xanthine oxidase. So this leads to irreversible inhibition of xanthine oxidase. Let us take another example. Aspirin. Aspirin, we know acetyl salicylic acid. It binds to cyclooxygenase by, it causes acetylation. It acetylates the serine residue in the active site of COX, and in this way it causes irreversible inhibition of COX. So let us take few more examples. So the suicidal inhibitor, the enzyme inhibitor, and what is the use. So suicidal inhibitor like clavulanic acid, olivanic acid obtained from natural sources, then the penicillinic acid, sulfones like sulbactam, tazobactam, they inhibit the enzyme beta-lactamase, and this beta-lactamase is also called as penicillinase because the first antibiotic is penicillin, which is a beta-lactam antibiotic. So penicillinase is also known as beta-lactamase. So these drugs are used with beta-lactam antibiotics in beta-lactam resistance. So when there is beta-lactam resistance because of beta-lactamase enzyme, we use these drugs in combination with just we have discussed the example of amoxicillin plus clavulanic acid. Similarly, piperacillin plus tazobactam. So in this way these combinations are used. Disulfiram we use to discourage alcoholism in patients who are alcoholics. So to discourage alcoholism we use disulfiram, and it inhibits acetaldehyde dehydrogenase, thereby accumulating acetaldehyde, which produces an unpleasant reaction to discourage alcoholism. So this is, so disulfiram is another suicidal inhibitor. Aspirin already we have discussed, a non-steroidal anti-inflammatory drug and also used as antiplatelet drug. Then penicillin is another suicidal inhibitor which inhibits transpeptidase, and penicillin we know is an antibacterial antibiotic. Zidovudin used as anti-HIV in treatment of AIDS, inhibits HIV-1 reverse transcriptase enzyme. So zidovudin is another example of suicidal inhibitor. Irreversible inhibitor of acetylcholinesterase are the organophosphate compounds like parathion, malathion, which are used as insecticide, pesticide. They are other examples of suicidal inhibitor. Then ornithine decarboxylase inhibitor, irreversible inhibitors of ornithine decarboxylase like afluornithine and alpha difluoromethyl-ornithine DFMO, used in sleeping sickness. 5-fluorouracil, the anti-cancer drug, the target is thiamidylate synthase. So 5-fluorouracil is irreversibly inhibiting thiamidylate synthase. So it is another example of suicidal inhibitor. Exemestane, the anti-cancer used against breast cancer, irreversibly inhibits aromatase. So this is another example of suicidal inhibitor. Vigabatrin, the anti-epileptic drug, is another example of suicidal inhibitor which inhibits irreversibly GABA transaminase enzyme. Allopurinol, the anti-gout drug, inhibits xanthine oxidase. Already you have discussed. Let us take few more examples. Benzothiazinone, the new class of anti-tubercular drug, they are also examples of suicidal inhibitors. They inhibit the enzyme decaprenyl phosphoryl beta D ribose 2-epimerase DPRE1. So this is another example of suicidal inhibitor. Then benzotriazole esters used against severe acute respiratory syndrome. They inhibit the enzyme proteinase. So this is another example of suicidal inhibitor. The monoamine oxidase inhibitors like parzylene, the derivative N-dimethyl proparzylamine, tranylcypromine, the antidepressants, they are other examples of suicidal inhibitor. Selegiline, the MAO-B inhibitor used as antidepressant, it is, and also mainly this is selegiline is used in Parkinson's, anti-Parkinsonian drug. Selegiline, this is an example of suicidal inhibitor. Acyclovir, the antiviral drug which irreversibly inhibits thymidine kinase, this is another example of suicidal inhibitor. So this is all about the suicidal inhibitors. Thank you.